All right, I'm Langston Smith, and today we're going to be having class again here at the Three Angels School of Health. And we're going to be dealing with the nervous system again. We started yesterday talking about the nervous system, but today I want to finish up. I want to talk about the autonomic nervous system. I need everyone in the classroom to sit down and to be quiet, please. Thank you. All right. The autonomic nervous system, okay, we listed again that there are three parts to the nervous system. Does anybody remember those three parts?
Central nervous system, or CNS.
So the central nervous system, okay.
Peripheral nervous system.
The peripheral nervous system, okay.
Autonomic nervous system.
And then the autonomic nervous system, okay. So, or ANS. All right. The central nervous system, it consists of the brain and the spinal cord, correct?
Yes, that's right.
The peripheral nervous system are the nerves that go out from the spinal cord out into the other parts of the body, right?
Okay, yes.
So it is the peripheral nerves. It's the nerves that extend out. The autonomic nervous system is what we're going to be studying today. Okay? The autonomic nervous system. Okay? And it has two parts which we're going to talk about. All right? I'm begging Pudi and his brother to really be quiet. I understand. Pick them up off the floor, please. All right. And so it says here on page 29 of the paper that I gave you, autonomic nervous system, you can blink or move your finger at different speeds, but you can't change how fast your stomach digests food. I want you to take that in. When you are eating, it doesn't matter if it's a peanut or if it's a sandwich. Digestion takes the exact same amount of time. Meaning, there is a process for digestion, and when we deal with digestion, we're going to go over this. And so that process, okay, I want to stop everybody. Put all of your pencils away, put them in the box, and pull them out one at a time. Thank you. All right. Okay, and so it says that your stomach is going to digest according to a process. Do you know what your stomach digests first? Just say, I don't know.
I don't know.
It deals with liquids first.
Okay.
And if the liquid is cold, it will heat up the stomach first. Then it will deal with the liquids, and then it will deal with the other parts. Father in heaven. All right. The stomach, like other organs, other internal organs, and the smooth muscle tissue of blood vessels, functions involuntary and is under the control of the autonomic nervous system. Please stop, little one. It says, ANS. This system regulates the body's life-sustaining functions almost independently of the central nervous system, which consists of the brain and spinal cord. The autonomic nervous system is also the division of the peripheral nervous system that conveys messages from the central nervous system outward to produce responses in involuntary muscles and tissues. There are two main parts to the system, the sympathetic and parasympathetic systems. Many organs have nerves coming from both systems. These nerves produce opposite reactions. For example, one nerve may respond to low blood pressure by increasing the heartbeat. The other nerve will slow the heartbeat when the blood pressure is too high. Similarly, when the level of carbon dioxide in the blood increases, the cerebral spinal fluid becomes more acidic. The acidity activates chemical receptors that stimulate the respiratory center of the medulla, which increases the rate of breathing. Increased breathing in turn eliminates excess carbon dioxide, thereby bringing the level of blood back to normal. If too much carbon dioxide is eliminated, however, chemical receptors initiate slower breathing to increase the level of carbon dioxide. This is the function of the autonomic nervous system. The autonomic nervous system has two parts. What did we say those parts were?
2 parts.
On page 13, you can see it there. It's called the sympathetic and the parasympathetic. Okay? All right. Very important that you know how this works. If you're going to be a medical missionary, you need to be able to reason from cause to effect. You must understand the effect of something, because pushing something one way, the body is much like a pendulum. Anybody know how a pendulum works?
One extreme to the other?
No, it's yes, but it's straight. Yeah, that's exactly right. It swings from one side, which guarantees, because of the laws of it, it will swing back to the other side, because it's always trying to reach the center. All right. So you'll see on your paper on page 29, it says you see all the different parts, and you're supposed to color those in and turn them in. I wanted you to do that before we had class. Page 29. The glands, the eyes, the nasal mucosa, the trachea, lungs, heart, liver, gallbladder, stomach, pancreas, duodenum, and the small intestine, the large intestine, the rectum, the female and male reproductive organs, the kidneys, the uterus, and the bladder. Okay, all of these things here. They are all parts of the autonomic nervous system. Autonomic means that it operates automatically. You understand? You don't necessarily have overt control.
Involuntary.
Okay? Now you can have control over it, and I'm going to show you that in a moment, of how, but not control in the sense of you directing it, but control in the sense that your fears can direct it. All right, and I'll show you that in a few moments. All right? As a matter of fact, let me show you this video before we do any of that. You ready?
Yes.
All right.
The function of the autonomic nervous system is to mentor them in response to stress. The commander of this system is the humble hypothalamus, located in the diencephalon of the brain. Say hi for us, Mr. Thalamus. The autonomic nervous system is divided into two portions, the sympathetic and the parasympathetic systems. Your own parasympathetic system may even be active right now, because its responsibility is to take charge when the body is at rest. But what happens should you become aware of a threat? Now the sympathetic system takes control, speeding up your heart rate and respiration in what is known as the fight or flight response. You can either retreat or fend off your foes, and your sympathetic system provides the opportunity for either. Of course, sometimes threats aren't so manageable. When you perceive that resistance is fruitless, your parasympathetic system takes control, and you freeze up like a deer in headlights. Better luck next time, Slugger.
All right.
Within your nerve system is a branch called the autonomic nervous system. This is the component responsible for the regulation of subconscious bodily processes like breathing, reflexes, digestion, and organ function. The ANS can be divided into two branches: sympathetic, fight, fright, or flight, or parasympathetic, rest, digest, restore. We can experience instantaneous imbalance, or we can experience long-term compounding imbalances.
The sympathetic response ensured the survival of our species. If we're confronted with a life-threatening situation, our bodies will react by redirecting the blood and resources from the immune and digestive processes to our arms, legs, and brain so we can fight or flee. A shadow of this response is also triggered chronically by everyday things. Things like the daily commute, or money worries, or deadlines, or food choices, or the 100 emails you get a day, or the fact that there is just never enough time. All of these things are stresses, and they all add up to tip the balance of your ANS towards the draining, sympathetic dominant state.
The parasympathetic response also ensured the survival of our species, for without it, we would not grow and regenerate or heal from taxing situations. When we are in a relaxed and safe place, our bodies have the ability to slip into a state that allows us to recover and restore. Prolonged parasympathetic dominance can find you staying too long in that slow and steady place, and that's when you may find yourself becoming lethargic, apathetic, or lacking a spring in your step.
All right.
Within your nerve system is a branch called...
All right. And another.
Your autonomic nervous system is the part of your nervous system that controls involuntary actions, such as the beating of your heart and the widening or narrowing of your blood vessels. When something goes wrong in this system, it can cause serious problems, including blood pressure problems, heart problems, trouble with breathing and swallowing, erectile dysfunction in men. Autonomic nervous system disorders can occur alone or as a result of another disease, such as Parkinson's disease, alcoholism, and diabetes. Problems can affect either part of the system, as in complex regional pain syndromes, or all of the system. Some types are temporary, but many worsen over time. When they affect your breathing or heart function, these disorders can be life-threatening. Some autonomic nervous system disorders get better when an underlying disease is treated. Often, however, there is no cure. In that case, the goal of treatment is to improve symptoms.
And another.
So here's just an overview of how this is working. So similar to the HPA axis, there's signals that are coming from our cerebral cortex. So these are things we're aware of, conscious thoughts. That part of the brain has connections with the limbic system. So the limbic system is, it's been called our more
All right. Finally, we get to a point where somebody mentions this. The autonomic nervous system is a part of something called the limbic system. We've heard them talk about it already. It was something that they called fight or flight, right?
Or fright.
No, fight
Okay.
or flight. Meaning you receive strength, energy to either fight your way out of it or enough strength and energy to run your way out of it. But if you feel overwhelmed, this is your sympathetic. Your parasympathetic will cause you to turn where you just surrender and don't do anything. That's when you get eaten by the bear or the lion or whatever it is. You understand? There are two parts of this system, which is autonomic, which is connected to the limbic system. And we're not going to talk a lot about the limbic system yet. I'm going to go over that possibly. What stops sympathetic? Digestion immediately stops. The same as under fight or flight. Because you don't need to digest your food if you're running from a lion or if you're about to fight a bully. You understand? You don't need to digest. You also don't need to fight your cold either. Immediately your digestive system stops. Just like I want you to. Okay? All right.
So it has all these different kinds of effects here. In contrast, the kind of partner system to the sympathetic nervous system is the parasympathetic nervous system. So this is not an exact mirror, but it's pretty close. It's often referred to as the rest and digest system in contrast to the fight or flight.
So they like to call this one here, this is fight or flight, right? System. This one is what they call the rest and digest system. You understand that? This one allows for rest, but if you stay too long here, you become lethargic. This is when you're rich, increased with goods, and have need of nothing. And no, it's not. This one here, you know your need.
And as an example here of some of the kind of opposite effects it has to the sympathetic nervous system, it slows down your heart rate, it stimulates digestive activity. So this is what you want if you're resting and you're, for example, digesting a meal.
All right. Last two. They're doing tests with the sympathetic and parasympathetic. Measuring heart rate while your hand is in a bucket of cold water. How to activate your sympathetic. You see this? How to activate your sympathetic. You have to bring it under stress.
I know them.
I need you to be quiet, please. So, activate sympathetic nervous system with ice water stimulus. Okay? Activate your sympathetic. Place your hand in ice water and measure its effect. Your heart rate should increase. So you prepare ice water. All right? There you go. Put water in there. There you go. Okay. Place adhesive electrodes on the arm. Connect red alligator clips to the forearms. Connect black alligator clip to the palm. Connect hair and brain to spiker shield. Plug it into the computer. Connect to spike recorder. Zoom out the signal so that you can see it and turn on the filters. All right, if the signal appears upside down, like that, interchange the red alligator clips, put them on the other arms. Now it's correct. Measure resting heart rate by setting a threshold detection. Your upper left arm displays your blood pressure, beats per minute, excuse me. Place your hand in ice water. 60 beats per minute. 70 beats per minute. 80 beats per minute. 90 beats per minute. 100 beats per minute. Investigate the mammalian disorder, I talked about mammals. Heart rate should decrease. Submerge your face now fully in cool water. 60 beats per minute. Drops down to 50 beats per minute. A subtle decrease in humans. Without holding your breath, do the same. Use a snorkel. It was 60 beats per minute. Now watch what happens. Down to 55. Is it really decreasing? Just holding your breath now. All right. Examples of how your sympathetic and parasympathetic nervous system works.
The autonomic nervous system is part of the peripheral nervous system and it controls the functions of the internal organs of the body. We are often unaware of the autonomic nervous system because it controls involuntary actions. It regulates the heartbeat, process of respiration, etc., which we cannot consciously control. Autonomic nervous system consists of many pairs of nerves and ganglia. Ganglion is a structure containing a number of nerve cell bodies, typically linked by synapses, and often forming a swelling on a nerve fiber. These ganglia are found on the either side of the backbone and close to or embedded in the organs.
So ganglia is found where?
Autonomic nervous system
Backbone,
consists of
close to
two
the backbone.
components called
And the organ.
the
Yes.
sympathetic and parasympathetic systems.
All right. All right. Excuse me. All right, so let's go back to our papers. Okay. I wanted to go over the autonomic. I want you to look at page number 13 that I gave you where it says autonomic nervous system at the top and page 13 right next to it. And I want you to see, I also have page 12 right next to it, and you'll see where the nerves come from that control the various parts. Do you see that? Okay. It has, you'll see where the ciliary ganglion is for the eyes, and you'll see where the various ganglions are located for the various different parts of the body and the different organs. Do you see them?
Which page?
Page number 12, autonomic nervous system. So the nervous system, now listen to me, it looks like this. Okay? All right. And so there are various nerves. You can see where the vagus nerves comes off where the medulla is, and it's number 10 there, and you can see it comes down and it goes down and deals with the larynx and the trachea. And that nerve also goes down and deals with the heart and the liver, the spleen, down to the pancreas, the stomach, the kidneys. You can see that one nerve and its connections. Also, you can see the other parts. You can see in the center here, right here, so it says superior cervical ganglion, middle cervical ganglion, inferior cervical ganglion. Okay, superior just means above, inferior means below, and the one middle just means it's in the middle. And you can see the greater sympathetic nerve goes down. You can see the various different ganglions there. They're located nearby. Now the parasympathetic and the sympathetic are, listen to me, there are two lines of nerves that go down, right? This is why the nervous system is so important. One is going one direction, the other is going the other direction. They're not using the same line going back and forth. All right? And so you can see the effector organs on page number 13. The eye, the pupil. The sympathetic dilates the pupil, and the parasympathetic does what? Page number 13. This one here that says sympathetic and parasympathetic. You see it? Are we there?
Constrict people.
Okay. So parasympathetic causes constriction of the pupil, but what dilates it? I need you to look at your paper, not at me.
Sympathetic.
I don't have it.
Sympathetic.
I gave you page 13.
And who's the
No.
It's going to be in all of the nervous papers I gave you. You told me that you had it.
Yes, there we go.
Okay, thank you.
Okay, all right.
Which
The
page?
eye, okay, for the eye also the ciliary body, it bulges the lenses for close vision.
Okay.
Okay, you can see the lacrimal gland. It's the sympathetic. It stimulates tear secretion. So what causes you to cry?
Lacrimal gland.
Yes, the lacrimal gland, but it's the parasympathetic.
Parasympathetic.
You understanding? Okay. The submandibular gland initiates saliva secretions, or inhibits. I'm sorry. Stops sympathetic. Stops saliva secretion. Sympathetic. It stimulates it. You understand? Sublingual gland inhibits saliva secretion, but the parasympathetic stimulates it. You can see the same thing. Sweat gland is stimulated by the sympathetic, but nothing stops it. It just stops on its own. Okay? Erector pili muscles stimulates contraction. Your lung, the sympathetic dilates, and the bronchioles, and then the parasympathetic does what?
Constricts.
It constricts the bronchioles, because we're going to be talking later on today about the lungs. Okay, the mucus glands in the lungs. The sympathetic inhibits secretion. The parasympathetic stimulates secretion. The heart rate. Sympathetic increases heart rate. Parasympathetic decreases heart rate. Okay, the heart. Coronary vessels. Sympathetic increases blood flow. Therefore, the parasympathetic will do what?
Constricts blood flow.
It will decrease blood flow. Yes. Okay. The pumping of your heart, the pump strength. Sympathetic increases the force. Parasympathetic does what?
Slows and steadies.
Slows and steadies the heart. Blood vessel constricts most organs for the sympathetic, and the parasympathetic doesn't have very much effect, they say. Okay? Your liver stimulates hydrolysis of glycogen. The spleen, likewise. You can see all the different ones. I need you to understand this, because this is going to be on your test. It's going to be on your what?
Test.
It's going to be on your test. All right. And so, impulse pathway underneath. In the somatic nervous system, a single neuron whose cell body is found in the spinal cord and whose axon is in the peripheral nerve stimulates the effector organ, or the skeletal muscle, directly. In contrast, the autonomic nervous system uses two neuron chain to stimulate the effector organ, or smooth muscle, cardiac muscle, and glands. The first neuron has its cell body in the central nervous system, and the second cell body is outside of the central nervous system in the peripheral paravertebral or collateral ganglion. The first motor neuron in the chain contains a preganglionic neuron, a cell body that lies within the central nervous system. Its axon, known as the preganglionic axon, synapses with the second motor neuron cell body, the ganglion neuron. The ganglion neuron resides in the autonomic ganglion, collection of neuron cells, cell bodies outside of the central nervous system. Basically what this is saying is that part of the cell is in the central nervous system and part of it reaches out into the peripheral nervous system. Okay, up there. All right, so there are things on here I want you to look at, really look at, and quiz each other on. I'm going to stop there with the nervous system. Okay? Yes.
Now you said the autonomic nervous system is connected to the limbic system.
Yes.
Would that be more the parasympathetic effect? Because that seems to be the emotion.
It's both. Because you have conflicting things that are going on there. But yes, it is more of the sympathetic than the parasympathetic brings you back to normal. This one,
Oh, okay.
you understand? But the organs that stimulate this are in the brain and not actually a part of Well, this is they're part of the central nervous system somewhat. I'm going to explain that as we look at it, okay? That's why I separate them with the limbic system. All right. We're going to stop there, and we're going to take a break, and then we're going to come back, and we will deal then with the respiratory system. Do you have any questions before we continue on? Yes? No? Maybe?
So
All right.
your nerves also control emotions. Or
Your nerves are involved in your emotions,
Okay.
not necessarily control.
It's the limbic
All right.
system or the frontal lobe that controls.
Let's pray. Father in heaven, thank you for your grace, and I pray you be with us now. Help us to know the parts of the body. Help us to understand the function of the sympathetic and parasympathetic nervous system in the autonomic nervous system. And Lord, help us therefore to know ourselves and how to help others. For this we pray in Jesus' name. Amen.